Hello everyone, let's try to solve this question together. So a preterm infant undergoes exploratory laparotomy on day 30th of life. She is on multi-vasopressors for low blood pressure. Her urine output in last 24 hours is 0.8 ml per kg per hour. An X-ray is obtained, which you can see on the right side of the screen, and that is post-operative day 6. And then you have comparison available on day 6. So 30 days apart, two X-rays are given in the question. What do you guys think is the correct choice here? Zoom the picture. Okay, the correct choice here is fluid imbalance. So what you guys see here is that is most evident or worrisome. So let me show it to you. See, if you see here, look at this skin thickness. There's so much of fluid collection in the skin. I don't know if you guys can appreciate, but see the bilateral fluid here. Here, if you compare, you barely see any fluid outside the chest wall. And also here, look at the ballooning of the abdomen. So it's SITs and a lot of fluid collection. So it has to be some fluid imbalance. And that is again with this urine output of 0.8, probably the patient is in syndrome of inappropriate secretion or is retaining fluid because of the the need for vasopressor. So maybe the blood pressure is lower still and needs to be adjusted. So anyway, looking at the picture, we can easily make out that B is the right choice. Now what about the other choices? So what about the first one, the mean airway pressure? An easy way to look at on the chest X-ray is to look at the heart size. Is the heart compressed or not? And in both picture you see it's okay. It doesn't look like that the heart is compressed. And not only that, if you see the lung expansion, it does not look to compress the diaphragm of the heart. Diaphragm is relatively flat, but when the MAPs are high, you will see really like a tubular heart like this, not like this. So that's why A is a wrong choice. Now what about lung expansion? We already covered that. The lung expansion looks okay. It doesn't look like concerning for now. Now what about the central line? For central line, you have to follow the right line here. It's coming there and it sits at the junction of superior vena cava and right atrium, so which is a good position. So you don't have to worry about that as well. So I hope you guys have learned something together today. The basic idea about whenever you shoot an X-ray, always look at the signs of anasarca in babies who are retaining fluid and have hyponatremia and have low urine output and needing vasopressors. And of course, like we addressed, you have to look for other problems as well, like looking at the heart shadow, looking at the lung expansion. So I hope you guys have learned something together today. Have a nice day. Bye.